All right. Once again, good evening and welcome. My name is Yong Hao. I'll be your facilitator today. I'm actually a social worker with Viria Community Services. In particular, I'm with the Viria Grief Support Program. Today is the last of our three-part series of Let's Talk About Bereavement. Today's topic will be on coping with bereavement. This series is supported by Temasek Foundation through its Stay Prepared initiative. Stay Prepared helps to prepare the Singapore community for emergency like major accidents, natural disasters, pandemic, severe haze, or terrorist attacks. It is supported by Temasek Emergency Preparedness Fund and managed by Temasek Foundation. Today, we have the honor of having Professor Amy Chow. She is a full professor from the Department of Social Work and Social Administration, the University of Hong Kong. She is also the director of the Jockey Club End of Life Community Care Project in Hong Kong. She was also the chairperson for the International Work Group on Death, Dying, and Bereavement. She comes with many years of clinical practice as well as academic research. So today we really have the honor of having Professor Amy Chow to join us and share with us tips and knowledge about coping with bereavement. Just before I hand over time to Amy, please do share your questions if you have any into the chat box there. We will actually collate the questions and probably answer at the end of the session as much as we can. All right, without further ado, can I invite Amy to begin your presentation?
So thank you, Yong Hao, for the kind introduction, and thank you all for joining this this late evening sharing session. And let me share my PowerPoint first. I'm very honored to be one of the guest speakers for this series, and I do think bereavement is a very important topic that a lot of people are facing. So today, I'm going to talk about 5 aspects of bereavement and see how we can support a person who are facing bereavement. So before I start, I usually want to engage the participant, and I hope you can join me to join some poll. So do you think grief is about sadness only? So you can indicate your choice. So 75% has voted, and I can give you 5 more seconds. Okay. So do you want to see the result? Now, from your group, 97% consider grief is not restricted to sadness only, but 2 of you consider grief as sadness. Now, maybe I share my observation and also the literature from international research. So a lot of people is telling us that grief is not about sadness only, and it includes other emotions. Now, if you join the research team, they actually telling you that grief is not only about emotion, it includes your cognition and also your behaviors and also symptoms, physical symptoms and physical reaction. So that's why when we first introduced bereavement counseling in Hong Kong, we actually had a difficult time to find the Chinese translation of bereavement counseling, because at that time we adopt the Taiwanese definition of grief. We translate directly to sadness, 哀傷、悲傷、輔導. But in my heart, I don't think this is an accurate expression. Now, because what I'm going to talk about is when you lose your loved one through death, grief or sadness is a normal reaction. But if you say to someone that, oh, if you lose your loved one, please come to receive sadness counseling and to take away your sadness. Now, I do think a lot of bereaved persons find it unacceptable because they think my sadness is a normal reaction. Now, so what are the other reactions that we think it is more problematic? So can you think of any emotions that are problematic in grief? The first one that I observe quite often happened is anger. And that part may also ruin the relationship, the other existing relationship. Now, but it is not uncommon. After a death of the mother, the father always quarrel with their adult children and on only trivial issues. Now, that doesn't mean that the relationship is not good, but sometimes it might be a normal reaction in grief, including anger, and that will spoil the existing social relationship. But a lot of time, in particular for Chinese, I do find that guilt is very common among bereaved person. They think of all sorts of things and say, if I have done this, he wouldn't be die. I wish I have done something. So they keep on blaming themselves and had a lot of guilt feelings. Now, even if you have done nothing, a lot of time in one of our studies, we actually found that as a child, you find yourself not caring your parent enough. It is already a sin, and it is a guilt origin. So make sure we also listen to the bereaved person's expression of guilt. Now, but sometimes you also have a sense of jealousy. In particular, if someone lost their wife, probably when you see someone with a wife, you don't know why, but you had a taste of jealousy in your heart, and then you relate with your friends in an inappropriate way. So that is also an issue, and regret. And also, this is another key point, loneliness. Now, in some of our research, we actually found that loneliness is an important reaction that will affect other mental health and also physical health indicators. Loneliness doesn't cannot be relieved if there are people around. A lot of bereaved person actually said, even though I am not alone, but I still feel very lonely because the people around you might not understand how you feel, and then eventually they become very very lonely. So someone helped me to make it less lonely by drawing a line. And also shockness. Sometimes even if you are very well prepared of the death, but at that moment you still feel it is shock for you. And sometimes you keep on yearning, trying to locate the deceased person, even though you know it cannot be useful, but still you try to yearn and search for that person. And you also have a lot of other conditions like preoccupied with the death scenes and also with the disease. You also ask about only if I do this, he will be okay or not. And a lot of time they also ask, how is he going on? Is he well? Is he okay? So that's why a lot of people like to seek spiritual media for help in order to connect it to the spirit and see how they are going on. And they also have a lot of questions. Maybe they have anger. They said, why does he or she doesn't come back? Not in my dream and not in form of butterfly. So they ask this kind of question. And they also have a self-depreciation attitude by saying that I am now not worthy. I'm not worthy to have him. And also think that without him, they are nothing. And they also want to know whether there are any afterlife. Now, there are other behavior. Of course, the sleeping and eating situation change. Sometimes they eat more, sometimes they don't have appetite, depending on whether they need food as a gratification or whether they don't sense anything, they don't feel the hunger. Or either they sleep overslept, or maybe they have insomnia. So sleeping, eating is an important behavior that we observe in bereavement. Now, but these are very important because these two affect the immunological system, and maybe they are more prone to have infectious disease, and they may have health issues. Or maybe the anger turn into hostility, or maybe they cry in order to express their frustration, or they hate to communicate with others because of the jealousy, or they don't know how to deal with the others' care and concern. So maybe they will social withdraw, or they find themselves very tired. And sometimes they also avoid, like they don't go back to the place that they spent with the disease. They even find the other way, they travel to another way to go to some places. So the avoidance sometimes happen. And I also want to bring your attention to somatic symptoms. Now, there are research showing that a lot of time bereaved person have the same somatic symptoms similar to the disease. Now, but the first important thing is ask them to have a medical checkup and make sure they are really okay. Sometimes maybe they are having a same habit or living in the same environment. Maybe they really share the same illness. But most of the time, this similarity in the somatic symptoms are due to psychological reasons. Probably they want to share the connectiveness with the disease. So the only thing maybe they remember strongly is the symptoms manifestation. So if the husband died of stomach cancer, probably they find their stomach not feeling well in order to share the suffering of the deceased person. And maybe they had headache, or maybe they had heartache, or I actually have clients who share that after the death of the loved one, they lost their eyesight. Now, maybe this is also reflecting the inability to see what had happened. And also, maybe they cried too much, or maybe they sleep less. That also affect their eyesight. So eye problems are not uncommon. Now, in one of the research, they also found that the sensitivity to color contrast is also affected by your emotions. Now, if you are a little bit upset, or not feeling energized, a lot of time when you see the world, you see it is more gray. Now, it is not only linguistically, you look the world seems to be gray, but actually it is the reaction of your eyes. Your sensitivity towards the color contrast is lower. So a lot of time they don't see the color. When they can sense the color again, then it is a good news. That means their emotions are going back to the pre-morbid situation. And can you test when you go to that place, and then when they watch the television, you can see the contrast. Is that very sharp? If it is very sharp, that means their sensitivity is low. That's why they adjust the television screen into a great contrast and color. And lastly, as I said, their immunological system may be affected, so they are more commonly to have a common cold. So maybe I should ask you another question and let's see whether you want to join. So this time, if you have a friend who is bereaved and then they start to cry, will you offer him a piece of tissue paper? So I give you 5 more seconds. So more of you will share a piece of tissue paper. That is what I did in the past. But then I learned from my client. First of all, when you lost your loved one through death, if you shed a tear, it is a natural reaction. Tears actually had function, and first of all, the ingredients inside the tears had a meaning, because most of the time, in particular for emotional tears, they consist of some toxic material. And also when you cry, it also have a function in the neurological process. You feel a catharsis, and you feel a little bit relaxed, and then you can sleep. So there are function in crying. But if you pass them a piece of tissue paper, now it seems like you want to let them stop their crying, and most of the time it is interpreted as the permission of not to cry. So that is something we need to take note of. Now, but of course, it doesn't apply to all situations. If you find your bereaved friends start to have nasal discharge, now I do think they feel embarrassed. A piece of tissue paper will help to let them feel less embarrassed. Or maybe they start to have nonverbal behavior, looking for tissue paper, and then at that time you pass the tissue paper to them and it matched the expectation. It is fine. Our suggestion is not to offer until they show sign of need of tissue paper, because if you remember the last time you passed a tissue paper to someone who cried, most of the time they don't say thank you, but most of the time they will say, I'm sorry. Now think about why they say, I am sorry. Probably they feel guilty of making you embarrassed because they are crying. So next time, think about that. Now, according to the laboratory research, they actually found that crying, the tears, actually helps the risk of having the upper respiratory infection. So crying at times is good. So next time when you cry, you can say, oh, I'm just making my eyes more lubricated, and also I secrete some enzyme, which is antibacterial, and I will have less chance to have upper respiratory infection. But this research is in the old days. I think most of you are not yet born. And at the same time, little bit recent research in the 1980s, the American researcher, they also found that in the emotional tears, there are toxic matters. What are the toxic matters? They are ACTH, which are stress hormones. So if you drop your tears, in particular induced by emotion, it is helping you to detoxify the stress hormones. And they also find that if you cut the onion, that is the irritant tears, and when you think of something very emotional, these two types of tear actually have very different content in the albumin, which means the emotional tears are having more stress hormones. And also crying had the social impact. So when you see someone cry, as you all said, you try to offer the tissue paper to them. That means it helps to you communicate your distress, and you might be able to solicit some help from others. Now, at the same time, when you cry, your anger, your aggression will also be relieved a little bit. So that's why it will turn into more reflective behavior rather than action or hostility. And also, when you cry, it builds the connection. You show your vulnerability. Most of the time, people will turn into that person, and then stay more connected to that person. And then you will be elicit more sympathy and empathy. Okay, so another question, and let's see whether you would like to, you have your point. Now I see that someone asked question. Probably I will put it at the end, and then we can address it together. So the next question, do you think willpower can control our grief reaction? Now about 3/4 consider we cannot control, and 1/4 consider we can control. Now, I have to say, all this kind of question are dichotomized. Most of the time, it is in the middle. So I will say both of you are correct. Now, but for those who say no, I think it is also the observation in most of the cases. Now, before I move to the scientific part, I would like to go back to the biological and nature part. I don't know whether you have seen these pictures before, but I think they are very powerful tools to communicate to bereaved person. Now, before I answer willpower, let's go back to these pictures. Now you see this is a bird, but this bird is injured, and her partner is doing the carrying role because he knew that the bird is injured. She couldn't get any food, so he is so nice and he just caught some food for the injured partner and then feed her as well. Now, but unfortunately, no matter what he did, the female bird cannot survive and she died. Now, I hope you can take a look at the facial expression of the bereaved bird. He looks shocked, is that? And then he keep on yelling, hoping he can wake up the deceased bird. But after some trial, he's still crying and calling for the bird. But like you observe, there is a physical distance. And he eventually accepts this is the reality, but still he cannot control himself. He keep on yelling and hopefully wake up the deceased bird. Lastly, he accepts this as a reality and he just quietly stand by the side of the deceased bird. Now, why am I putting these pictures to you? When I first saw this, I was very, very surprised because a lot of time when I was working in the emergency room, I see this kind of cases. So when a person is announced to be dead, you can see the family members, no matter how educated, how well-mannered they were, once they was informed about the sudden death of their loved one, they all yell and they all push the body and they really want to wake up the deceased person. So I think there is a nature reaction, a natural reaction that whenever someone we love suddenly die, we can't accept it. We try our best to bring them back to life. This is a very normal reaction, which cannot be controlled easily. So I hope you can see the biological part of our grief reaction. Now, other than that, there are also research findings, in particular with the advancement in the brain imaging. So recent research actually showed that for for bereaved person with complicated grief, they actually have a different structure and also activities in their brain. Now, what does it mean? Now, from the title, I think you can catch the meaning. They said when your loved one die, when you are having complicated grief, you seems to have a reaction like craving for love. And then your grief actually activates your reward center. Now, what does it mean? It means that the reward related activity is more like the addiction reaction. So you know this is not good for yourself, but you can't control. You keep on ruminating, you keep on thinking about your loved one. So it had the addictive like addiction like properties, and it is not easy to control. But at the same time, it is related to pain. You feel the pain, but you still put yourself into that cycle, and then you can't come out. And that is how the complicated grief persons are going through. Now, the reason why I put this up is sometimes we think the bereaved person can be strong and can be stand up and forget and move on. But if you are the one who go through the process, sometimes you really find that you have no control and you still have the emotions, you keep on thinking that person. So I hope we are more accommodating and accepting the bereaved person's reaction and understand that sometimes they had some difficulties in control because their brain had been a little bit affected. So another question, do you think everyone who go through bereavement are in need of support. So every bereaved person are in need of bereaved support. So 66% said that 66% said that no, and 34 said yes. So that depends on the definition of support. Obviously, maybe they need some practical tips, maybe they need someone to listen to their sharings. But if we talk about the support that is more related to psychological counseling, that kind of support, then not everyone is in need. Now, maybe I would like to share with you the research finding, which is quite old as well, for 16 years ago by George Bonanno. And he is a bereavement researcher. And originally, there is a United States studies on older couples. They track the trajectory of health of older couples in America. But unfortunately, some of the participants of the research die in the middle of the research because the research lasts for 4 years or 5 years. And then someone died in the middle. So George Bonanno stepped in and said, can I take a look at those who die and their family members' reaction? So that's why they had a very special data set, include pre-bereavement situation and post-bereavement situation. Because in Hong Kong or right now, we can't do prospective bereavement research. We can't keep on chasing one another, the subject on the pre-death situation and then wait for one of them die and keep on measuring. It is not easy, but only when this is a territory-wide research and they have a large number, then it automatically comes in and then we can do it. Now, what did they found? They actually found that there is a group, no matter whether before or after death, the depressed symptoms are high all along. And this is called the chronic depressed group. Now, I hope you can understand that the geriatric depression rate is also about 8 to 10%. So this is an elderly group, no matter their spouse are around, they are feeling depressed. But this group, more likely, their depression are more related to their original situation. They are having chronic depression and they may be more receptive to pharmaceutical support. Now, but there is a group who is quite different. But if you just look at the post-death situation, they are very similar with the depressed group. But only when you ask question, when you check the pre-death situation, you actually found that before the death of the spouse, they do not have any depressive symptoms. And this group, after the death, no matter 6 months or 18 months, they are having quite high depressive symptoms. Now, this group, we call them chronic grief group, but it is not a high percentage. It only occupies about 16%. Now, so this is the group which we think they need support. And in particular, they are more prone to, more reactive to psychological support because they don't have a medical origin on their depression, but it is a reaction towards the death of their loved one. So this group are the target group of the counselors and the social workers. Now, but there is another group whom we call the normal grief or common grief. They are not, they are okay before the death. They are not okay in the 6 months, but marginally manageable. But after a year, 18 months, they go back to normal. So we expect this is the common grief. Now, but out of George Bonanno's surprise, this group only occupy 11%. So they start to think, where have all the others gone? Now, there is another group which is quite interesting. They have strong, high depressive symptoms, but after the death, they are working well, and even it's sustained till 18 months. So this group is called depressed improved groups. But probably the quality of marriage is not so good. Now, not because they are not so good. Most of the time, they had been struggled for the illness for a long time. So probably the surviving bereaved person think that, oh, it's the end of the suffering of my loved one. So before the death, they feel the pain of their loved one, affected by the physical illness. But after they die, they have a strong religious belief and think that the husband or the wife is now in heaven enjoying the life. So they don't have the depression for the surviving bereaved person. So this group also not too much, but it is about 11%. The majority actually fall into this group called resilience group. So they are doing well before the death and after the death, 6 months and 18 months. Now it doesn't mean that they don't have problem in the first few months, but about 6 months time, they are recovering quite well and they are working as before the death of the situation. And even though they have some yearning at the beginning, but they are still fine. And this contribute nearly half of the population. Now, so this study hope to give you some idea. It is not everyone they need support after the death. Some of them can, in particular, half of them, they can go through their grief without any support. But there is a group which is about 16% may be in need of some support. Now, actually, around the world, this number changed. In George Bernal, another study, he found that 25%. And in China, in Hong Kong, we have found that 4 to 5% of the situations only. So can I ask you another question? Do you think letting go of the past is the best way to get through the pain of bereavement? So let me show you. Majority also said no. So maybe you are familiarized with the theory of continuing bond. Now, actually, there is a classic book by William Warden, and that book is called Grief Counseling and Grief Therapy. And in the first edition, which was published in the 1980s, he said that there should be 4 tasks in facing grief and bereavement that include to accept the reality of loss, to work through the pain, and to adjust to the environment in which the disease is missing. And lastly, is to withdraw the emotional energy. That means you let go of the death. Now, but in his second edition, which is published in 1991, he changed the wording. He actually said to emotionally relocate the disease and move on with life. Now, so you can see that he also changed his orientation. In the past, we always console the bereaved person by saying that you have to let go. But recently, they are talking about the concept of relocating the person. You can still have a connection with that person, but the important stuff is you put it in a very special place and then you still have to move on with life. Now, this concept has been elaborated by Dennis Klass and Philip Silverman. They introduced a concept called continuing bond. Now, Dennis Klass used to spend his time for sabbatical in Japan. And that is where he had the concept of continuing bond, because he stayed in a Japanese family and he find that there is a family altar and people start to communicate with their ancestors from time to time, and then their mental health and their bereavement reaction seems to be doing well. So Dennis start to question, is it still good to maintain a bond? Now, at the same time, Phyllis Silverman is working in America, and she works closely with children. And she also finds that children had an innate reaction by communicating with the deceased loved one from time to time and maintain that connection. And the children's well-being is also not affected. So that's why they developed the concept of continuing bond, meaning that maintaining a bond with the deceased after the death is still therapeutic in a way. Now, but later when the research started to blossoms, they actually find that there are controversies between the positive side and the negative side of the continuing bond. But I do think that Nigel field studies can help us to understand, because how you maintain the relationship makes a difference. Now, if you make it like the good memories, or if you make it like you identify with the disease, taking the disease habit and values and interests, or maybe you follow the standard of the disease, or maybe you set up a legacy of the disease. Now, this may be therapeutic and help your mental health, but you are nervously, paranoidly maintain the possession, like keeping the items, and then always have the sense of insecurity of losing the items, then this may not be good for your health. So we need to differentiate what kind of bonding that you want to maintain with the disease. And also, when you reminiscence, you remember the good memory or the memory that you argue with your disease, that also makes a difference. So what we talk about continuing bond need to be refined, the way you show the continuing bond. So last but not least, I would like to share that grief actually is complicated by a lot of losses. So I hope to introduce this concept to you. So when someone dies, it is not the only loss a person is facing. So when we want to support a bereaved person, we need to explore what are the concurrent losses at the same time. Probably they have a lost sense of security. They become very paranoid, and they also become very angry because they want to grab on something to have control. So when we support bereaved person, make sure the sense of security and also the sense of control is very important. Now, but at the same time, if someone dies is the breadwinner, and probably you also have some financial concern and tangible concern, or maybe the house that you are saving is still on mortgage and you are not able to pay. So probably you have to move to a smaller house. This is some form of secondary loss as well. Or maybe like some parents, when their child is died, you lost your daily responsibility or your role, and it also makes someone feel uncomfortable. Now, don't think that they don't need to take care of a patient. It is good, but sometimes people prefer to have a role, to prefer to work. And also, they may lose some social connection. Now, say for example, for patients, children's pediatric cases, it is the case. The parent can go to the hospital every day. She maintain a good connection with others, patients, parents. But if their child die, they find it very difficult to connect to other parents because their other parents' child are still living. They don't want to influence emotionally on the other parents. At the same time, they also have some jealousy towards the other parents and thinking that why are your sons still surviving but not my son? So these are also making them a barrier in develop the relationship. And also they start to have a sense that they cannot feel the joy anymore. And this is also problematic. Now, again, this is a good reminder for everyone. A lot of time we want to cheer up someone in bereavement, but actually maybe they had a temporary loss of joy and ahodia. So even if you try your best to please them and to make them feel good, and it doesn't necessarily works well. And sometimes bereaved person even want to make you feel good, and they pretend to be happy to make you feel at ease. And so that will make them very stressful. And at the same time, they also lost some status. I heard from some bereaved person sharing that in the past, I am a wife, I am Mrs. Chan, but now my husband died. I am no more Mrs. Chan, I'm just a widow. And for some people, when both parents died, they said, I used to be a child of someone, treasured by someone, but now I'm an orphan, an adult orphan. And so you can imagine the word that they describe themselves also is a loss. And lastly, And most of the time, they also lost their future. They don't know how to move on. The meaning of life are also affected. So these are all the other concurrent losses which we can also address when we have to support the bereaved person. Now, last but not least, grief is not that simple. It is a tingling reaction of multi-level of losses. So we are not only addressing about the reaction, we should also try to understand what are the causes, what are the secondary laws, what are the laws that make that person have that kind of reaction, and then respond accordingly. And after all, I have to say, working on bereavement, sometimes the most important task is listening. And if you understand, if you can read the Chinese character, I would like to share that the Chinese character listen actually had deeper meaning. It means you have to use your ears and eyes to listen. You had to have total attention. And you also have your heart wholeheartedly come when you listen. And also you have to treat the one who share as a king and respect them as a king. And I hope this is a message that you know how you can support a bereaved person. Now, lastly, for those ladies who like a diamond, you remember if you had to assess a diamond, you use 4C. Do you still remember what are the 4C? Clarity, color, carat, and cut. Now, I do think bereavement care also have 4C, which are help them to maintain some form of connection without stigmatization, show them the care when they feel the need in tangible and practical help them to find ways to cope, and lastly, to let them have a sense of control over some other things. So, and also you have to reflect on different dimension. So this is the last slide. And grief, according to Colin Parrs, he actually says something in his book, and he said, grief is the price we pay for our love, and it is the cost of commitment. But at the same time, love is the crucial therapeutic factors for problematic grief. So if they grieve because of their love, the friends, the other caring persons, you can use your love and listen to their sharing, and it is already a very good start for a bereaved person. So that's the end of my presentation. And then if someone want to repeat the 4C so you can see the PowerPoint, yeah. So first of all, I pass it back to Yokhao and see,
Yes.
yeah, thank you.
Thank you, Amy, for the very, very informative session and explanation on the topic of coping with bereavement. First and foremost, before we jump to the Q&A, I noticed in our audience there's a mixture of professionals as well as lay person. I want to manage some expectation here. The online forum for this round is actually meant to be public, right? So in terms of the content knowledge, for some professional, you may find it a little bit basic, but the intention was meant to be basic. To the idea of building community competency, Amy, and just now you mentioned about actually not everyone need professional support, right? Yeah. So that is part and parcel of our effort in building that community capacity and capability to help fellow people who are in grief. So I just want to note this to everyone in the audience because I was looking through. There's quite a bit of professionals among us as well. Yeah. So I'm very mindful of time. We're actually about 10 minutes away. So perhaps I'll do this first before I jump to Q&A. First thing, the slides today will be made available to anyone who has attended today's session. However, I do need your help in dropping your email address into our feedback form. If not, we don't know where to send this to. So I will show you what's the link first, just in case you need to leave, right? So everyone could have that information first. Yeah. So just in case you need to leave, you can't stay for Q&A, and you would like to have a slide as well, please fill out your information through this feedback form. You can scan into a QR code or through the URL. my fellow colleague will also drop the URL link into the chat box where you can conveniently click into that link to give your feedback and drop an email address if you wish to have the slides. Okay. All right. With that, let's go into some of the questions. I think very, very interesting questions. I think my colleague has populated some. Perhaps we start off with this. I think there's a question of tissue.
Okay.
Yeah, if the person seems to be trying hard not to cry, but eventually cry, should we let them cry or help them to stay strong? And if I let the person cry, what can I do or say if I'm not supposed to pass in the tissue? Because it feels very uncomfortable.
Mm-hmm. So actually, if someone is having tears, most of the time they are preoccupied by their memory. They are not so aware of your reaction actually. So what you need to do is sit there silently and watch their breathing rhythm. If they are still breathing naturally, I think they are fine. Only when you find the breathing start to be a little bit suffocated and you worry about whether he will have hyperventilation or if they have hypertension or whatever you worry, then this is the time you intervene with the tissue or you pour them a cup of tea. But if they don't have a very alarming reaction, probably the best way is just stand by, watching, and then that is good enough. Now, but after they stop the tears, they start to look at you, then this is the time for you to react. You need to say something because they look at you after the tears, and then I always have this kind of reaction, and I say, thank you for your trust and showing your real emotion in front of me. It is not easy for someone to express the emotion, but from your tears, I now start to understand how much you love your deceased person. Now, always say something positive towards their tears, and then they feel that it is not embarrassing, it is normal to cry, and that will give them some reassurance. Yeah, and most of the time, if you have tears, probably for the first time, you cry 100%, and after you cry for some time, maybe the next time you won't go back to that peak. You only need 80%, and then it helps them to regulate their expression. And this is good because this is a safe place for them to cry. And when they go out to see other friends who are not so understanding, and then they can still contain themselves. So that is my suggestions. Yeah.
Okay, thanks, Amy, for that response. I would like to prioritize some questions. I know some questions are asked in chronological order. So I'm the moderator here, right? So I want to prioritize some questions more gearing toward a bit more general in terms of the professional as opposed to the professional questions. But we'll still come to that. I think one of the questions, can we have the next slide? I think it's the next slide.
Okay.
Yeah. How can one provide support? Sorry, the previous slide, please. Yeah. How can one provide support or respond to someone who for years has been asking, why did the deceased leave her alone? Can we also combine this with the idea of complicated grief and prolonged grief disorder? I think one of the audience asked in the first question as well.
Now, a lot of time when someone had a cognitive reaction of bereavement, if we do not provide space for them to reflect, and when they do not find a good answer, they will keep on asking the question. So that's why you don't need to give them answer. A lot of time, bereaved person will say a lot of questions. Now, if you can answer them within a short time, it doesn't help because it reflects they are stupid. They spend years in asking the question without finding the answer. And you are so smart, only in a few seconds you have the answer. So that makes them feel upset. So the way is to explore the question like, what have you discovered? What have you think of? And why this question is so important? What will you do if you have the answer? What are the possibility or what are the possible answer that you have already think of? Now, so our role is to be a reflector, help them to have reflection and let them have more feedback, and that is good enough. And sometimes I also recommend some books, like the books written by bereaved person, and say, I don't have the answer, but probably when you understand from the others' bereaved experience, maybe you will have some insight. That will be a way that you can address this issue. And I have to say, after the death of your loved one, you will have a lot of spiritual questions that may not have answer forever, but still, it is a way that you can work on. But maybe I use another example to tell you. Sometimes, in particular for suicide death, they will ask this kind of question. Is he really suiciding? Is he angry with me? Or how is he doing on? Because suicide person is sinful and maybe they go to the hell. That they have a lot of this kind of question. And the suicide bereaved person are very upsetting. And once upon a time, I do an exercise with them like this. I ask them to put all the question they have into paper, into small pieces of paper, and one piece of small paper for one question. And then I ask them to put into one balloon and blow it. And then without hiding the balloon, he hold all the hands, all the balloons. And then I ask them to just experience how it feels. And then he say, I feel tired, my fingers start to feel upsetting. And then he asked me, when am I going to release the balloon? And I said, it is up to you. And then, of course, the counseling session cannot last forever. So he knows that the time is going to be end. So he relaxed his finger, and then the balloon fly here and there everywhere. And suddenly he had a realization. He said, I now understand what you mean. If I keep on holding the question without any answer, my hands will not be function. And I also feel the tiredness and the brain. Only when I let go of this stupid question, and then my hands can be used to do meaningful things. Now, sometimes you had to help the persons to discover this. But if the question is meaningful, they can still spend time on asking and reflecting and through reading and talking to people.
Thanks, Amy, for sharing that. Very, very experiential. I think sometimes we only remember about talking to people and all we use is words, but using external mediums to help process and help others to grieve more healthily. I think that is very, very powerful example that you had there. So I also want to ask this question also, a very, very practical, not practical question, but very real life example question, which is, I have a friend whose partner died and he keeps saying that it is for better, it is for the better, and he said no need to think too much. He seems quite unaffected. Is it normal, even though it was not too long ago?
I do think that we should trust the person expression. If they say something like this, and I don't think we need to think they are pretending or mask their grief. Let them be themselves. Now, but occasionally, in particular for special days like the anniversary day, or maybe it is the Valentine's Day, maybe their emotions are affected. Then you can still approach that person and see whether they are doing well. But I do believe that some people, maybe with their religious background or with a very special relationship beforehand, they will be okay. Now, I still remember one of my clients is telling me something like this. He said, I promised my wife before she died, I won't get upset because I know that if I'm upset, she will be unhappy. Now, so let them do whatever they promise. If they promise their wife not to feel bad and then they try to fulfill that role, let them do it. Because if we interrupt them and they also feel guilty to his wife. So I do think we have to trust them. But you can say occasionally, if it doesn't work, if you need a pair of listening ears, do think of us and we are around. It doesn't mean that you are not doing well. It just means that occasionally there are challenges which is stronger than what we have expected, in particular during the special time.
Yeah. I'm very mindful of time. It's 9 o'clock. So I would ask the audience, perhaps we take another 5 minutes to answer the last few questions.
Yeah, sorry for
Yeah,
overrunning.
no. I think these questions are all suggesting that I think we are all very interested in this topic. I think I will summarize some of the question. I think some of the question is looking really about timeline of grief, right? Some say cry after 1 year, still repeating the same story. Should we stop them? Some asking, how long do people usually take to grieve? When we reach for death anniversary, do we just ask if they've gotten over the death already? So I think there are some milestone timeline questions to that. Yeah, do you have any tips or experience around that?
The bad news is I have to say the grief never go away. It has to be lifelong, but the intensity, the frequency is usually reduced after some times. Now, according to the American Psychiatric Association in the DSM-5, they also set up a new disorders called the persistent complex bereavement disorders. And it states that if the symptoms of yearning and discomfort last for more than 1 year, then it had a chance that it is a mental challenge. So 1 year is the definition by the American Psychiatric Association. Now, recently, the WHO, they had the ICD, which is the International Classification of Disease. They use a different concept called prolonged grief. And then they suggest that if the symptoms last for 6 months, and then that will be a problem. Now, so there are two versions. So 6 months and 1 year is something that we have to watch out. This is the timeline. Now, but there is another prescription which I also want to highlight. It doesn't mean that after 1 year you won't have the grief. It only states that after 1 year, if the time that you have the grief is more than the time that you haven't, then this is a problem. So that means if you occasionally, once in a week, you still have some reaction, emotion, now that is fine, that is okay. As long as your functioning, your daily functioning, that means your social relationship, your work, occupational functioning are okay, then it is still okay. Now, but if your friends keep on repeating the same statement, and then I do think they are also in great pain as well. So one of the statements that I sometimes use is, I will say, oh, I would like to ask you a hypothetical question. What if your husband is sitting by our side, listening to your sharing every day, same old question asking, can you imagine how he will respond? What is his reaction? Now, this is a way to help them to break through. The reason why they are repeating is they cannot break through. So we need to ask questions and let them put themselves into different scenario, because I do think that they are very lonely. They want to see the response of the disease. So we help them to imagine, to put themselves into that situation and to connect to the disease in such a way.
Perhaps one last question, and again, I'm going to thematize this. I think some question asked around, okay, so if a person has whatever, be it PGD or the complicated grief diagnosis, and even if they don't, what kind of professional intervention are there in terms of counseling or intervention to those diagnostic condition?
I have to tell you, up to today, there is no strong evidence base of what can be done to help a person with complicated grief or prolonged grief disorders. But someone do believe that cognitive behavioral approach can help. And on my side, I have work on the group work called the dual process model. And it turns out to have an effect when compared with traditional bereavement counseling, which is mainly on talking about the disease. But both studies actually had effect, but the dual process model had a much higher effect. But I think we need at least 3 or 4 hours to work on it rather than talking it generally. But I have to say, my personal experience is you need to look for what are the challenge the person is facing. And then you have to intervene according to the presentation of the problem. Maybe someone find themselves loss of meaning of life. So probably your work is more on the meaning-making process. Maybe someone said they miss the person so much, they want to be connected. So probably some work in building the continuing bond can be helpful. So it really depends on what is the most disturbing problem of the patient. Now, one key point I want to highlight is sometimes the death is a traumatic death. And then maybe the bereaved person is suffering from an ambivalent situation. On one hand, she wants to recall the experience, recall the connection with the deceased. But whenever she thinks of the deceased, she thinks of the traumatic scene, which makes them feel very, very uncomfortable. That kind of tension also makes the persons very complicated. And what we need to do is we need to take care of the traumatic symptoms, and then we also have to work on the grief. So there are multiple ways to work on. So my key point is targeted the intervention according to the symptoms and manifestation.
Great. I think really last question, because this person repeated the question 3 times. So I think it's like, I really want this answer to be question to be answered. Is it normal or all right for a person to prepare for bereavement?
Research has used a concept called anticipatory grief. And if prematurely you have the anticipatory grief, it actually do harm more than do good. Now, but that really depends on how you prepare for. If you prepare for by spending more quality time with that person, you build up good memory, you also try to learn some coping mechanism in learning the task and the responsibility of the deceased. I do think that kind of preparation will help your grief. But if you prepare yourself by blocking your relationship, by distancing, and definitely it will do harm more than do good and makes you feel you have regret and waste the time you have together.
Yeah, thanks Amy for sharing. Okay, so that's the last questions for today. Just a roundup for today's session. But first and foremost, I would like to really express my sincere gratitude to Professor Amy Chow for taking time to share with us your experience, both in the academic and the clinical experience. I believe we receive a lot of wisdom from you in how we can work with in a professional, or even we are not professionals, supporting our loved one who are in grief as well. So thank you very much, Amy.
You're most welcome.
Okay. So this series is supported by Temasek Foundation through its Stay Prepared initiative. It does set up a part of the initiative is set up in my mental health website. So the COVID-19 pandemic can take an emotional toll. Learn to manage your mental well-being, and if you need support, we can show you how and where to seek help. So one of them is go to the website, and you can actually read about some of the resources there. Now, we also have a resource for professionals among us who are here tonight. Okay, we are running a diploma in systemic grief and bereavement care. We are running our foundation for the second time, and this time we are doing on an online basis, 26 hours over 8 weekends. We are tentatively starting on the 26th of February 2021 next year. And also for those who are a little bit more experienced professionally, we have an intermediate level for you, 6 days and three hours group supervision sessions. We are starting to start around July 2021. So the trainers are Professor Kenneth Doka, who brought us this term called the disenfranchised grief, one of the experts in grief and bereavement. Of course, Professor Amy Chow, who are with us today, as well as Dr. Gilbert Fan, who actually shared with us how to say goodbye in our session last week. So if you're interested, please drop by his email, or in the feedback form, drop your email as well to let us know. Finally, we are also planning for workshops for lay person, not professionals, for lay person, for friends, for grassroots leaders, for insurance agent even, right? So how do we support people who are bereaved that come across in our field? It could be our friends, our family members as well. So do keep lookout for that. It's probably, we want to target that sometime in the middle of next year to start the workshop. All right, so do tell us to fill out a feedback form. So give us let us know how we can do better, and also drop an email address if you want to receive the slides, as well as keep updated about our latest offering services. from the grief support program. Other than that, thank you very much. Have a great evening ahead.